Finally, some good news as the nightmare that is 2020 comes to an end: a vaccine. Vaccine approval has begun, starting with Pfizer and BioNTech. But with health services already burdened after months of the pandemic, how easy is a mass vaccination program going to be?
We know that state and local health departments have had a big burden of cost as they've been planning for all of these activities around vaccine distribution.
And are people willing to even take it when it arrives?
Once you get the vaccine available, it's approved, the bigger hurdle is distribution and buy-in.
It's hard to believe it's been nearly a year since we first started hearing about a new respiratory illness. Despite the relative newness of the disease, vaccine production has been record-breaking.
We really thought it was going to take 18 months or more to have a vaccine ready. And yet here we are, not only with 2 candidates on the horizon, with more to come.
There are over 17 million confirmed COVID-19 cases and over 310,000 deaths in the US. These are the 3 most talked about vaccines, all of which received some sort of funding through Trump's Operation Warp Speed. First, there's Pfizer and BioNTech. Pfizer didn't take funding for the research and development of its vaccine, though BioNTech did get funding from the German government. Pfizer will receive funding from Warp Speed to distribute the vaccine. Then there's Moderna. It received $955 million worth of taxpayer money through the Operation Warp Speed initiative. And finally, there's AstraZeneca and the University of Oxford, for which Operation Warp Speed provided $1.2 billion worth of taxpayer money. So, how does the US plan to roll these vaccines out? The CDC advised that healthcare personnel and residents of long-term care facilities should be first in line. But when it comes to actual logistical organization of who gets a vaccine when, that comes down to each state. And this system of governance, where states have a lot of autonomy and there are limits to federal authority, is one of the reasons why the US response to the outbreak has been disastrous. And it's also why getting a coordinated vaccine response across states will be a bit tricky. 2 of the front-running vaccines, Pfizer BioNTech and Moderna Inc., need to be stored at low temperatures and require 2 doses, which makes distribution especially complex.
The Pfizer vaccine should stay at negative 70 degrees Celsius. It is going to be shipped in a special container where dry ice would be added to it after 5 days and again on the 10th day. And then after that, there are 5 more days that it could stay refrigerated, but it has to be used within that time period.
I think it's going to require an incredible communication lift for people to understand once you take that first dose that you're going to have an immune response, and that's good.
The now FDA-approved Pfizer vaccine will be hard to get out to people in rural areas as the vaccine loses viability within days while in transit. That's over 57 million people. But having a vaccine is useless if you don't have the resources to distribute it. Health departments across the US were already struggling before COVID-19. Years of austerity policies means funding for public services and public health is not only not prioritized, but is also often on the chopping block. During the pandemic, health departments have been using federal money from the Coronavirus Relief Fund, or CARES Act, to pay for the extra costs of the health crisis. But both health departments and the wider US population are in desperate need of more help.
We're not going to go home for the Christmas holidays unless we make sure that we provide for the millions of families in this country who are suffering.
By now, most people know that the United States doesn't have universal health care. So what does that mean when you're in the middle of a pandemic and everyone needs to be vaccinated? Over 2/3 of people in the US had concerns about potential out-of-pocket costs if they fell sick over the course of the pandemic. And this pandemic hasn't affected the US equally. Black, Hispanic, and Latino people are 2.8 times more likely to die of COVID-19 than white people.
What are all the reasons why we see this disparity or this disproportionate negative outcome for people of color? The larger reasons are systemic, right? So they are, what's our healthcare infrastructure? Who has access? What's our food security look like? Housing? Who can afford to stay home?
Joe Biden has pledged that all Americans will get access to the vaccine for free. And despite the over 26 million people in the US who are uninsured, state health officials are making plans for widespread free vaccine administration.
There will be mass vaccination clinics where there will be no administration fee for getting the vaccine, and there'll be other opportunities as well. I know there's going to be outreach done to homeless shelters, for example.
But it's becoming clear that richer countries are going to have earlier access to the vaccine. The US, Canada, UK, and EU are among those that have already reserved enough vaccinations to immunize their populations many times over. And that's before poorer countries even have access to a vaccine. The front-running Pfizer-BioNTech vaccine looks set to make nearly $13 billion in global sales. They're selling the vaccine to countries at $39 for a 2-shot course. Other drug makers like Johnson & Johnson and AstraZeneca have said they will make their vaccines available on a not-for-profit basis as the pandemic continues.
We know that the virus doesn't see country borders, and certainly we'd like to make sure that we protect the lives and livelihoods and such of people all around the world.
So let's say there is a vaccine. It's free and states have found a way to distribute it fairly. Will people actually take it?
I knew in the back of my mind that people would be unsure, and some people would be like, no, this is so politicized. I don't want to take the vaccine.
And there are many reasons for that. Some of it comes from anti-vaxxer messaging widespread on social media. But the issue of vaccination skepticism is far more wide-reaching than a small group of die-hard anti-vaxxers. Just 51% of participants in a September 2020 poll said they would take the vaccine if it were available today. And the skepticism isn't confined to one political side. 44% of Republican-leaning voters said they would take the vaccine, and for the Democrats, it was 58%.
This is a very complicated history in the United States of scientific mistrust, of medical mistrust, especially with minoritized communities that have been preyed on to advance scientific discovery.
Mistrust of the medical field in Black communities comes from a history of experimentation. Some of those experiments, as recent as the Tuskegee syphilis study, deliberately stopped Black men from getting effective treatment for syphilis to examine the long-term effects of the disease. The CDC was running the experiment that was initially meant to last for 6 months. It lasted 40 years and was intended to follow the men until death. The study was officially brought to an end in 1972. So a large part of vaccination efficacy in the US is going to come down to whether the scientific community, states, and local groups can convince people to take it.
We ran some simulations recently. We're finding that we probably need around 50% of the population to have the vaccine to really be starting to get those major impacts from it.
Some research has suggested that if there had been cross-state policies and unified messaging earlier on, the U.S. might not be seeing hundreds of thousands of new COVID-19 cases a day.
When there is no transparency to that process, how science works, how it's continually changing, growing, we learn more each and every single day. When you come out and say everyone should start wearing a mask now, they don't understand why, and they don't believe your reasoning.
It may feel as though the pandemic's end is in sight with a vaccine just around the corner. But scientists are warning that the majority of people won't have access to it until well into 2021.
So we need to really continue these interventions, especially things like face coverings and masks, so that we can make sure to protect our communities a little bit longer until this vaccine has a chance to work.
And when it comes to skepticism in the United States, the scientific community has a lot of work to do to ensure enough people take the vaccine.
The next couple of months are going to be critical for the scientific community in communicating what is actually going on with the vaccine and why people should be taking the vaccine once it's available.
The return to a so-called normal life might be on the horizon, but normal might never look the same again.
We'll never go back to the way that things used to be. I think that people are more aware of how we pass germs. So I feel like people are going to still want a little bit of space.
Even if you did get a vaccine, I think if you got a flu shot and your dad got a flu shot, that still doesn't mean sneeze into his face. And I think we have to really think of it just like that. If you sneeze into somebody's face, keep your mask on even if you have a vaccine.